Welcome to a new podcast series called Heart Failure Realities, where we discuss the gaps between guidelines and practice. Today, I will be privileged to have Dr. Sonia Mirabet Perez, who is the head of the Heart Failure Unit at Sant Pau Hospital in Barcelona, to talk about the transforming heart failure care and the role of stakeholders. So welcome, Dr. Sonia.
Thank you. It's my pleasure to be here.
My pleasure. So, Dr. Sonia, starting, the heart failure is a complex disease involving multiple stakeholders: the cardiologist, the nurses, the pharmacist, the educator, so many stakeholders. How do you see the role of these stakeholders, and how do they complement each other in the management of heart failure patients?
As you said, heart failure is like a chronic disease or a chronic condition. In my opinion, require a multidisciplinary approach to ensure an integrated care across all the process, across all the disease, from the diagnosis to the end stage phases of the disease, including also the management during the admissions and the transitions between the different healthcare settings when the patient is being treated. We know that after an admission for heart failure, a close follow-up is recommended in the hospital to prevent readmissions, to prevent hospitalizations, and to improve outcomes and optimize medical therapy. But we know that for most patients with heart failure, long follow-up is managed in primary care. So nurses and case managers play a main role in facilitating the transition, in facilitating the communication between the different healthcare settings. And I feel that it's more important to improve outcomes in those patients with heart failure. Also, patients with heart failure have many comorbidities. So the collaboration with other specialties, as you mentioned, with nephrologists or with geriatrics, or even with palliative care in the stage phases of the disease is necessary to improve outcomes and to improve the quality of life of our patients. And also, patients with heart failure often have polypharmacy. So the involvement of pharmacists is interesting in order to try to simplify therapeutic regimes and also to enhance adherence for those patients. So I think that we should work all together.
And so it's nice that you mentioned also other specialties and the primary care physicians, which might be taking the lead in many of these patients having multiple comorbidities. So if we may call this the circle of care, what gaps do you see in this circle of care involving patients?
I think that there are several gaps. One of the main gaps is the fragmentation of care and the insufficient collaboration between all the professionals that take care of the patients. So I think that it's important not only to involve nurses and case managers. There are other strategies that we can implement. It's very important to share electronic medical records. It's very important to facilitate the information flow. And also it's very important to try to schedule face-to-face meetings between all the professionals that take care of the patients to discuss, to know the progression of the disease, to specifically discuss patients. That is a way to improve the results. Also, there are gaps regarding the education of the professionals, and I think that it's very important to regularly promote the update of the information about management of heart failure for all the professionals that are not cardiologists. I mean that it's very interesting to participate in educational programs with primary care physicians, or to participate in educational programs with other colleagues. I think it's a way to improve all together. And another gap is the patient and caregiver engagement. I think that is very important for all patients and caregivers to understand what heart failure is. It's very important that they understand the progression of the disease, and it's very important that they know the different options, therapeutical options that they have. Is necessary to identify signs and symptoms of decompensation, but also it's very important that patients know how to communicate and how to contact with these professionals when they identify. So I think we have to work in all of these.
It's definitely a big challenge, and getting people together to manage the patient as a center. The core now is the patient.
Yeah, I think that maybe also telemonitoring session is an opportunity to
advances. So what strategies can we implement through this circle of care to improve the adherence of treatment?
I think that coordination, collaboration, education are the strategies that we should implement, but also I think that we can promote the participation of the nurses in the care of patients with heart failure. I think that patients with heart failure, we have realized that they feel more comfortable communicating with nurses. I think that they feel closer to nurses. So this is a possibility to identify some barriers in the adherence and to try to solve these barriers. Also, I think that maybe nurses dedicate more time to explain the benefit expected with the medical therapy, but also that I think that they have more time to discuss with the patient the minor adverse events that they have and to provide strategies or advice to solve these. So I think that multidisciplinary team and the integration of nurses in all the process could be useful.
I think they'll improve adherence a lot. As an example, in Saudi have a real big challenge with adherence. These are long-term medications, compliance with lifestyle changes, with these medications on time and follow-ups. It is a challenge. I'm pretty sure the nurses would have a very strong role. So you in Spain had a very inspiring experience involving the nurses and the care. What started this initiative? How did it come along, and how did you see the impact?
Yeah, we know that the implementation of guide-directed medical therapy remains suboptimal despite all the recommendations. So this is one of the facts that we know. And also we know that heart failure unit, where cardiologists and nurses work together, have achieved good results in terms of optimizing medical therapy and preventing readmissions. So taking these concepts together, we decide to design a randomized trial assessing the results of the up-titration guide-directed medical therapy by nurses compared with the up-titration of guide-directed medical therapy by cardiologists. It was a non-inferiority trial. It was a multi-center, randomized, controlled clinical trial. Nurses should have more than 400 hours of training and at least 2 years of experience working together with cardiologists in a heart failure unit. And the results of the trial showed that the primary endpoint was met because the titration led by nurses was not significantly different than the up-titration led by cardiologists. Furthermore, the doses, the ACE inhibitors and beta blocker doses achieved were higher in the group of patients that were titrated by nurses, and there were no differences in adverse events. So I think that this trial highlights the role of the nurses, not only in education, not only in facilitating the coordination between the healthcare setting, but also in the implementation of medical therapy.
I was going to tell you it's a non-inferior trial, but I wouldn't be surprised if even it was a superior, they would do better. They are better than us in actually following steps and checklists, and that's crucial. So how did you see the roles in implementing the first line and the second line therapies of heart failure?
Nurses should be trained and should have experience, should have knowledge about heart failure, so they have the opportunity to detect more things, not only to titrate drugs. So they have skills to analyze an ECG, they have skills to analyze clinical variables. So in our experience, they not only titrate drugs, but they also consult us, for example, if they detect signs of the compensation, or for example, if they detect that heart rate is higher, or if they detect that the patient has a defibrillation that was not previously known. So they can suggest, sometimes they suggest how to modify therapy, and they consult with us things that they could offer more than only up-to-trade medication. I think it's very important that they have a good training and they have a good education about heart failure.
In general, there's a low uptake in therapies beyond the 4 pillars.
Yeah.
Did the nurses help in improving that?
Yeah, in our experience, not only they achieve the target doses in a lower period of times, most of them in 3 months, but also if it's difficult to introduce some drugs, you know that sometimes it's difficult because the blood pressure is low, and they can facilitate the titration using all the drugs that we have for the treatment of patients with heart failure.
From the patient perspective, did they have a better role in adherence of medications and compliance? What was the patient's perspective in all this?
I think that, as I told before, that the patient feel more comfortable communicating with nurses. I think that they have more time to explain their own experience. They have more time to ask about the drug that they are receiving. They have more time to explain the minor adverse event. I think that they need this time. Sometimes cardiologists just explain the disease, the procedures, and the patient and the caregiver too need more times, because every patient is different and every situation is different. And sometimes nurses provide some strategies and provide some advice that are very useful for patients to maintain adherence. And also I think that in each visit, the nurses educate the patients about the disease, because sometimes the patient receives such an information, too many information, that is difficult for the patient to understand all the process. So in each visit, the nurse remember what's the disease, remember what's the medical therapy for the disease, remember the signs and symptoms. And I think that it's very important because patients need to continue refresh the information.
And let's not forget that here the patient is the center of all this, and what gives better results for the patient is what we're looking for. So now, listening to your inspiring experience and the very good results you have, I'm pretty sure many people would be interested in implementing that. Many countries outside of Spain would like to have that. What advice would you give them to go through that?
First of all, I think that we should believe that it is possible to work all together. And then I think that we need to create multidisciplinary teams working all together. it's most important to educate patients in heart failure. It's very, very important, and to facilitate the communication and the coordination between all the healthcare settings. We need the structures, we need well-trained people, but I think that the future is to work all together in these multidisciplinary teams.
Excellent. So we did address very clearly the importance of the multidisciplinary team and how important each part of the stakeholders, nurses as well, and the outcomes and the up titration and achieving the guideline-directed medical therapy. At the end, thank you all, and I thank Dr. Sonia Mirabet Perez for her time and for giving us the focus on this very important topic. Thank you very much.
Thank you.